Hello there, and welcome to today's live. We'll be working on and speaking about promoting health justice through health and wellness coaching. My name is Araceli, and I'm here with Maxi. Maxi, thank you so much for being here today, this morning. How are you?
Hi, I am well. Thank you so much. And thank you for the opportunity to have this conversation with you. I'm very excited to talk with you.
Excellent, excellent. And Maxi, can you tell us a little bit about yourself? What do you do? What's your background?
Of course. Well, I'm a ACE certified health coach and functional training specialist. My background itself is very science and academic based, and so I transitioned more into wellness later on. So I have a bachelor's in biology with a minor in chemistry, and then I completed a master's in physiology and biophysics with a concentration in integrative medicine. I worked in academia for a while. I did research, specifically working with chronic pain patients and also healthy volunteers, looking at placebo effects, nocebo effects, pain, etc. And I had a couple publications and went to several conferences. So that's more of my academic background. Also currently an acupuncture student, a doctorate acupuncture student, as I'm also working as a health coach with several of my clients. And I am from Puerto Rico. I've been in the US mainland pretty much since 2015, currently in San Diego, California, since 2017, late 2017. And so here I am.
Well, that's a very impressive background, and um, we're more than lucky to have you here. So thank you again.
Thank you.
And for those of out there that don't know, you spoke to working with clients as a health coach and as a wellness coach. And for our pros out there who don't know, what is health and wellness coaching?
Yes. So I think the main thing about health and wellness coaching is we as coaches become a partner with our clients and help them, number one, identify their health goals and develop different programs and strategies that are individualized or personalized to fit our clients' needs in order to attain those health goals. So the key here is not that we're just imposing a goal. We have to help our clients identify their goals. And through that process, we really empower them to be able to continue working on this through a coaching program with us, right? But then also lead them into a maintenance phase in which they can actually continue with these changes and continue applying different strategies to improve their health or continue in their health and wellness journey. So it's part, we serve as a guide. We provide information, education. We create structured programs to help them reach those goals. And then we want to really empower them to be able to do that by themselves later on. I think that's
Yeah,
the best summary I can give.
yeah, right. To be able to create that autonomy and be able to have those long lasting goals as well. I always say, right, it's kind of sad when you let your client go, but it also means that you've done your job as a health coach. So for with that being said, which populations do you currently work with, and what has led you to work with these types of populations?
Yes. So I personally, I've always been very passionate about working with underserved populations. One of the main reasons was because I myself grew and was part of an underserved population growing up. And I firsthand experienced what it is to have difficulties accessing healthcare, and not just healthcare, because there can be healthcare isn't as standardized as you would think it is, right? It is varying levels of quality of healthcare that you can access depending on where you're at geographically, depending on a multitude of factors. So I've always been geared towards sciences and health and wellness. It's just the process was always trying to find where exactly I felt I fit. My skills would fit. So I work with people who may have some financial barriers to accessing the services a health coach can provide. I work with everyone, right? Anyone who needs my services, I'm happy to work with them. But I am particularly passionate about helping people in my community that don't necessarily have the resources to access services that are so essential. Aside from just health coaching, in general, because I serve as an educator and I can help them not only be an advocate for them, like myself be an advocate, but also try to help them be advocate for themselves in a clinical setting. And I think that's like really important when you're working with an underserved population. So that is, that's pretty much where I'm at this point in my life. And the reason why I feel like it's so important for me to work with these populations, it's because traditionally they're the ones that have the most difficulty accessing healthcare services in general, or quality healthcare services, but then also allied healthcare services like what you would consider health coaching or wellness coaching, personal training and movement coaching, whatever fits in those categories, that you don't get that in all clinical settings. And it's very important so that people can, like we mentioned earlier, bring that self-agency and be autonomous in their own health journey. So typically people who are able to access health coaching services have been people who have more money to pay for one-on-one coaching, which is, it's time consuming. And that is one of the reasons why that is. Also because people who are, whether they have more resources, more education, and have more access to other type of services, they also know about a health coach. They know that those services exist. Whereas if you have people from underserved populations, they might not necessarily know these services are there. So for example, in my experience growing up, that wasn't a thing, right? Like we didn't know that was it. We went to the doctor and, the doctor had more of a, that role that would tell us like where to go, what to do, and like this and that. But there wasn't a more holistic approach to it. There wasn't a multidisciplinary, I should say, more so than just holistic, a multidisciplinary approach to treating patients. And so that's where I want to try and bridge that gap currently.
And you bring up some excellent points, right, about bridging the gap, the factors, environmental factors, even knowing, right? And when you said growing up, we just went to the doctor, and that's kind of like your point of contact when it comes to health. And yeah, you bring up some excellent points of how can we bring this to these different types of populations, and specifically, especially right with these populations that may encounter like more obesity rates or different health risks, right? Just from not having that education behind it. So that's amazing work. So with that being said, and with that knowledge, right, like what are some different things that our current professionals, whether it be a certified health coach or wellness coach, what are some different things that they can implement into their practice if they are interested in working with different populations or just diversifying to help their communities?
So things that have worked for me and my own practice, pretty much, I try to keep in mind that there has to be a reciprocity, right? Like I know that I also have to make a living for myself. I have to sustain myself, but then balancing that with knowing that someone who really needs my help, may have a financial barrier to it. So having that mindset of reciprocity rather than just profit, it's, you're still charging money for a service, you're still making money, but it changes your mindset a little bit about that transaction, so to speak. So it kind of humanizes it a little bit more. So one of the first things I implemented, or what I've implemented and has worked for myself, is offering sliding scales. So before I even start a program with one potential client, I always have a short free consult, primarily, and this is something that not just to identify financial barriers, but in general, is something that's very helpful for health coaches, because we can identify if we are the actual practitioner that or provider that the client needs, Or does this person need a referral? Do they need, some other risk assessment? Or is there a liability? Should they go to the doctors first? Are they looking for a therapist instead of a health coach? Are they looking for, right? There's a physical therapist instead of a health coach. So we have the opportunity to gauge if in fact we are the person they need. So that is one aspect. And then I usually ask my clients, what are their expectations and what are they thinking this process is going to look like for them? And in that, or within that, there is a financial aspect. So I ask them, where's your budget to work on this goal that you've kind of identified for yourself, or are in that process of identifying. And we start from there. And so then I explain my services, I explain what I do, what I don't do, I explain the cost of my sessions. And then I offer a sliding scale as well, which is honor-based. It's honesty-based. I am not requiring any documentation or anything like that. I feel like that's the society I would like to live in, and we should all strive to live in. And so that's kind of like what I implement in my practice. So I allow my client to choose which number within that sliding scale, which usually has like $30, a $30 range. And then we start. So that is one thing that I've implemented that has been helpful. And it allows a person who has more resources to select, yeah, I will pay more for your services because it's worth it, but then also not create such a hurdle for someone who may have more financial difficulties in accessing my services. So asking for budget, having an honest conversation about expectations, and the application of sliding scales are pretty much things that I've implemented that I think would be helpful in general, to try and bridge that gap again, and reduce some of the barriers for people who live in poverty, or people who don't have a lot of income but really need our services.
Yeah, and those are things that we can implement, right? From if we wanted to start today to work with different populations as well. And I have heard and I've practiced some of those sliding scales as well. And I can already hear the people in the back saying, well, maybe everybody's just going to want to hit the smallest number and pay for the, more budget friendly amount. And in my experience, that's not been the experience that I've encountered. Can you speak a little bit more to that, just for those people that think that people might be dishonest, or don't want to pay full money for your services while you're still trying to run a business? What can you tell about that population for our pros?
Yeah, and that's very important. And again, talking about I guess how the type of interactions that we have as humans in our society, where we're like always worried that someone is going to try and take advantage of us and things like that. And I haven't had that happen to me, but I can't say that it would never ever happen somewhere. There are millions of people, and there are millions of opportunities for interactions, and that part is hard to control. What I can say, I haven't personally experienced that. I've had clients who pay for the lower end of my sliding scale, which is still enough for me and my business needs. And I've had other clients pay kind of in the mid range, and others closer to the higher end of my scale. And so I haven't found that the people I've worked with have been dishonest about their needs. So it's not something I've experienced. And I think it's a valid concern, but I don't think it's the majority of what happens. I think people do, especially if they are taking the step to work with a professional for their own health, and they value the service that they're gonna get, they're gonna pay what they can, honestly. So I think that also it's important. I didn't mention this in the previous question, but other ways we can go about it. If a sliding scale is still kind of difficult for a client, we can look at other options. So how can I diversify my services, or kind of be flexible with my services and still meet both my needs and my clients' needs? So for example, would it be worth it to do shorter sessions, longer sessions, and change the frequency of the sessions to kind of fit those financial needs for both of us? Or would something along the lines of just a detailed written program would be sufficient for a client? And then there could be a set price for that rather than like a constant, and maybe a check-in session every now and then, but rather than meeting like every week. So there are ways we can go about it. But the thing is that because the needs of our clients are so varied and are going to be individual, we have to assess that first and then kind of be creative with how we approach our work. And if we honestly want to help someone, then see how can I tailor my services to fit this person's needs? And if it doesn't work, then, we can always use, in that interaction that we're having with a potential client, like we hold some power, right? Because we're the person that's coming with knowledge and skills and things that can really impact someone's life. So if we aren't able to work with them one-on-one, perhaps we can find resources for them. Perhaps we can send them, hey, there's this like low-cost community clinic, or there's this other practitioner that works with XYZ, and try to help them find someone else that can help them.
Yeah, and you speak to value, right? And if they see that value, they're more than likely going to be honest with you. So thank you for touching on that point, and providing more ways that we can offer services and diversify our services as a health coach and professionals. And just to kind of seg here into part of our talk today, and speaking to Women's Health Month and looking at career advice, which you've already provided a lot of career advice to our listeners. What have been some challenges for you as a woman in the industry? I know you've mentioned that you moved here from Puerto Rico in 2015, which is, not that long ago, about 6 years ago. Were you health coaching then, before you moved here to the US, or how was that transition for you? And any other career challenges that you've encountered?
Yeah, of course, I'd be happy to talk about that. So when I left Puerto Rico, I was actually pursuing my master's degree. So I left to start my master's degree program, and so I didn't start working as a health coach until relatively recently. I started studying for the program in 2018, and then I officially became a health coach very early 2019. So I've been officially working as a health coach for about 2 years now. And my other previous experience in regarding health and physiology, which is how the body functions, really informs a lot of what I do. And I think it really motivates me to help to talk to my clients about like what their bodies are doing. So I bridge some of that knowledge and I bring it into our sessions. And so that's kind of how I mix everything in it. And I want to say that because I have my own practice so far. So I don't work for a gym. I don't work for a particular organization. I have my own small business, and I service people from the local community as well as people from Puerto Rico. So I still do virtual sessions and things like that. I haven't experienced something very specific within the industry that would be like a barrier for myself. But I will say that there are other things that have been challenging for me to overcome to kind of establish my own small business as a woman and things like that. So one thing I would say is, and I'm sure a lot of people may relate to this, is kind of breaking with intergenerational poverty. And when you have accumulated a surplus of wealth that you can use to just invest in any small business and kind of start up a business, or delegate work to other providers who could be like marketing, PR, or etc. It kind of enables or facilitates some of that process. So I've had to, as I'm sure other coaches have had to do everything by themselves and starting their own practice. So that's something that has been slightly challenging, but it still has worked so far, but it's made it a little more challenging. So that is something that I acknowledge as a challenge. Another thing that I think it's general for women in healthcare, and not just health coaches, but women in healthcare as healthcare providers. There are certain biases, right, when we that we've internalized throughout our life in terms of things we learn implicitly. We don't even know we learn sometimes. And you can probably ask any female doctor, any woman doctor, if they've ever had this experience of like being in scrubs or being, you know, at a networking conference or at a medical conference, and someone just assuming they're a nurse, or someone assuming that they're not necessarily in a higher up position or that they're not a physician and things like that. And so, although I'm not a physician and I haven't experienced that quite specifically, I can say that sometimes if I have conversations and I explain that I'm a health coach, some people have a perception that it's just like, it's not as science oriented as the way I practice it. It's not as evidence-based as I practice it. Or that it doesn't require a lot of education, or it doesn't require a lot of effort. So that's something I've experienced kind of generally, and I'm sure other people might have experienced that as well. So those are some things that maybe if you're considering entering the healthcare professions or the allied healthcare professions, things to kind of think about. So be really smart about financial planning and time management, so that, you know, if you don't have a lot of accumulated wealth, to just invest really a lot in starting your own business, so that that process is easier for you. And also being aware that there are biases that will have people sometimes unintentionally think that the work we do as women is not as high quality or is not as science-based. That's kind of what I can say.
Yeah, and thank you for being vulnerable and sharing that experience as well, right? And kind of providing and paying it forward with career advice as to what it takes to really build something from the ground up, especially coming from Puerto Rico and starting outside of the US, or coming in to start outside of the US. And yeah, it's almost like you have to work extra hard to prove yourself, to say, no, I have the knowledge, I have the letters next to my name, and it's been a lot of work, and this is science-based, just like anybody else has worked for it. And yeah, I can definitely speak to that as well. We could sit here for hours talking about the different experiences that we might have encountered. But yeah, that's definitely a conversation, right? And if we bring it to light, then we can make others aware of it, and we can start that conversation, and it's okay, and we can overcome those challenges together. So thank you again for sharing that. And staying along the same lines then, as a female coach and as a female health coach, when working with the female population, and for those who identify as a female population, what are some unique challenges that you've seen that they face as your clients? Can you share a little bit about that?
Yeah, yes, very important. And of course, like, because we are it's like, I think about us, like a client, or us as a practitioner, every human being, like this very large complex equation that has a lot of variables, and all these variables kind of exist for everyone, but at different magnitudes, right? Like they influence things more or less depending on what those variables are. So in terms of considering the intersections of gender, right? Specifically for talking about women, or people who identify as females or women, I want to say that one of the main things I've seen is having difficulties with balancing, whether if some of my clients are mothers, and so balancing if motherhood is or if parenting, I should say, is relying more on the mother for X or Y reason for that person, that can be that can have an impact on someone's ability to dedicate time and energy and money into a health coaching program to work on their health. So that is one thing that I always keep in mind. If I have a client who has kids, or they're a single mom or something along those lines, I keep that in mind, and I try to be flexible with that, and understanding and empathic about how that can be very challenging, especially this last year. I had clients that pretty much were educating their kids at home all the time, and it was harder for them to find that time and space to dedicate to themselves. So that's something that intersects with gender. Another thing that I can say that it's a little more complex, right? Because there are other factors. There's language factors, there's ethnicity, there's race, there's wealth and poverty, right? And geographic location. Again, like all these things intersect and can influence a person's ability to engage in a health coaching program. So for some women, and I've experienced this in other jobs that I've had, there is a pay gap. And so women who don't get compensated as they should for the work they do, there's already a financial barrier that's being created there. And then you accumulate that over time and over generations, you're creating a barrier overall. So that's another thing that I've seen that can be influential. It's just actually not having a lot of wealth and just kind of being stuck in poverty in some cases. Another thing is women having, because of society, right, and how things have been for a long time, still struggling a lot with their body image. And so there's a very fine line as health coaches. If we want to help someone lose weight, which is, it's valid, it can help your health, it has all these benefits, but that can trigger also a lot of body image issues depending on specific experiences that a woman has had in their lives because of societal pressures to have a body that looks a certain way. So trying to promote the idea that in the process of becoming healthy and being healthful, your body doesn't have to look this just one very specific way. And that it's not just like a moment, it's a process, and you can live healthfully as you are losing weight. You can live healthfully with a body that looks different. You can live healthfully in many, many ways that don't look, and just this idea that we've created or we've absorbed from just our upbringing and society of what a healthy body looks like. So that is another thing that I can say. And yeah, I think those are the things that come to mind. I'm sure there are other factors, but so far that's what I think is I've experienced the most with my clients.
Yeah, and you touched on 3 really powerful challenges there. And as a health coach and as a wellness professional, you have your hands full as it is, but you have such a powerful message to be able to help these populations. And just from talking to you, right, we could see that you have a deep understanding of what it takes to really, really kind of get in the trenches with your clients and understand them, their backgrounds, cultural differences, working with moms, single moms, like being able to take all these different cultural backgrounds as a health coach. And this is something that we can continue to make aware for other professionals, right? That might just work with one single population of clients. And whether they're trying to diversify their portfolio of clientele or not, this is a conversation that is worth having. So thank you for sharing your powerful message, Maxie. And just to top it all off, what is next for you? What else are you working on? If you can let us know here before we sign off.
Of course. And thank you so much for your words as well, Araceli. So I'm currently working on my personal training certification through ACE, just to add more in-depth, I guess, knowledge and experience about specifically exercise, even though I have the functional training specialist already program completed. So I'm working on that, and I'll be done with that in a couple of months. As I mentioned earlier in our conversation, I am finishing a doctorate degree in acupuncture. So something that I will eventually also apply in kind of bridging all of these services to be able to have all these tools to help people in the ways, in more ways, just other than just one. So those are 2 things that I am currently working on, and I am taking clients. I I have, my small business. So if you can find me on Instagram, you can search for my name, Maxie Blasini. That's like my more personal page. And my small business page is Vibrancy Health Wellness. So there I post more educational information, and have more details about some of my services, but you can contact me through either of those pages, and just continuing to work on this. I have a passion for pretty much strengthen community health, because that's kind of, we are as healthy as our community is as well, right? Like our community itself can impact how we are able to attain our health as individuals. So I will continue working on that line of community health and kind of bringing services to underserved communities, and that's a work in progress for now.
So many things coming up for you. Best of luck with passing your certified personal trainer exam and with your doctorate degree in acupuncture as well. And everybody, yeah, go check out Maxie's page if you have any questions or just to follow for more information. We thank you so much for being with us today. And for those of you watching through Facebook, thank you for tuning in. And with that, we will end the live. Thank you, Maxie. Have a great rest of your day. We'll talk soon.